Hi, my name is Ashlin I am the lead coordinator at Illumma. I'm going to be giving you a tour through what the process of ketamine infusion is going to be like. The first thing I'd like to talk about is the environment that we offer here at Illumma. When you come to the front door, one of our gracious staff will open the door for you and will scan your forehead to make sure everyone is safe and not sick when they enter our building. We'll offer water, ginger ale, or any type of tea to help relax the mood. Next, we're going to go into our Infusionist room. Our Infusionist rooms are spa-like for your comfort. We have a large screen TV, a recliner, and our monitoring equipment. You will have a paramedic in the room with you at all times so you feel safe and comfortable throughout your entire experience. We feel that Illumma is a very unique clinic because majority of our employees have gone through ketamine infusion therapy, and we can describe what it is and how it feels and be there to support you throughout your journey. A few things that the paramedic is going to have you hooked up to is our monitoring equipment. This includes a blood pressure cuff, a pulse ox that will go on your finger to read your oxygen, and electrodes. There are stickers that go on the top of your chest and your lower left abdomen that helps the paramedic watch your heart rate. To get your infusion started, the paramedic will have you sit down in the recliner and relax. We will then start the smallest IV that we can for your comfort. Once the IV is established, the ketamine infusion takes about 10 minutes to kick in. First, you'll start feeling warm, then you'll start feeling tingly. During my infusion, I personally felt like I was relaxing on the beach. The next thing you will feel after you start feeling warm and tingly is your tongue will begin to get thick. The next thing you will feel is the disconnect between your brain and your mouth. Some people feel like they're able to talk through their whole dissociation, but what the paramedic has realized is a lot of internal talk, and the patient is not actually saying anything out loud. We will be able to document and record any information you do say so you can pass it along to your psychiatrist or your therapist for further evaluation. There are 3 main side effects that we notice during the ketamine infusion. The first one is the urgency to use the restroom. We will have you use the restroom before your infusion, but at any time you feel like you need to go to the restroom, please let the infusionist know and we will be able to pause the infusion and go to the restroom. The second side effect that we see is nausea. We do pre-treat all our patients with a medicine called Zofran, and it goes straight into the IV. At any point, if you start to feel nauseous again, please let your infusionist know and we will be able to give you an increased amount of Zofran or a different medication that could help you with your nausea. And the third side effect we see with ketamine infusion is the concept of time. Sometimes it could feel like the infusion lasted only 2 minutes, and other times it feels like you could be in the infusion for 2 hours. If you want any type of control over your infusion, your blood pressure cuff will go off every 15 minutes. If you count them through your infusion, you can know how far along in your infusion you are. For example, if you feel your blood pressure cuff go off 4 times, you know you're about an hour into the infusion and you're almost done. Once everything is hooked up and you feel completely ready to start, the infusionist will start the pump and you will be able to watch a guided meditation on our big screen TV. This guided meditation plus the beginning of the infusion will release endorphins and make you feel extremely relaxed and able to progress into the infusion. Since you'll be wearing wireless earphones, if our infusionists need to get in contact with you, they will touch your wrist. You give them a thumbs up if everything is good. Give them a thumbs down if something is wrong and things need to be adjusted. If at any point throughout the infusion you start to feel uncomfortable or you feel like it is too intense, just raise your hand and the infusionist will come to your side. They will be able to guide you through any tough situation. If after the guiding you still feel like it is too much, we can slow the infusion rate. If you feel slowing down the infusion still hasn't lowered it to the point where you are comfortable, we can also stop the infusion. Due to it being IV, as soon as I stop the pump, we could give it a few minutes and those feelings of anxiety or discomfort should slow down and we'll be able to talk through whatever is going on in your mind. During your infusions, sometimes they will be hard, but that is okay and we will be with you through every step of the process. If you need an infusionist to hold your hand, if you feel like you want to cry and need a tissue, we will be there. Remember, wherever your mind is, ketamine will intensify that. So I want you to pick a saying or an intention that will help you bring yourself some ease when you get to an uncomfortable point. An intention can be as small as let go or I'm safe. Anything that brings you comfort, we're going to use those throughout the infusion. Ketamine is a tool in your mental health toolbox. It is not the quick fix. I want you to imagine that you have Pandora's box. and everything that you haven't wanted to think about or all the past trauma that has hurt you too much to process, you shove that in your Pandora's box and put it in the back of your brain. Then you've put a guard in front of it so you don't have to look at it, you don't have to focus on it. What ketamine's going to do is when you hit that dissociation point between the body and the mind, it's going to move that guard out of the way and it's going to slowly chip away at that Pandora's box. During this process, you're going to be completely relaxed, but your brain is going to start processing things, and that's where the true therapy of ketamine will come from. While your brain is processing, it is completely okay to be emotional. You can cry, you can be angry, but just know this is the safest place that you can be to express all these feelings. Nothing you say will be told to anyone, and all these emotions need to be let out. If this is the one place where you can feel safe, this next hour during the infusion is all about you. And that paramedic sitting next to you is there to support you through anything that might come up, or just be a friend there if you need a little bit more support. Once the infusion ends, the paramedic will slowly turn the lights back on and they'll remove your headphones. You might be a little disoriented, but we'll give you time to rest, and then we'll speak to you about what happened during your infusion. We'll remove the IV and get you unhooked. Once you feel ready to stand, we'll walk you to the recovery room. In this recovery room, you can hang out, close your eyes, journal, or meditate until our advanced provider comes in. When they come in, they're going to ask you how your infusion was, how intense it was, did anything come up. They'll also discuss with the paramedic what the paramedic saw on the monitor and how intense that it seemed from a physiological standpoint. At that point, we'll all get together and discuss what we should do for your next dose. Each dose is very individualized, and it goes off of how you felt during your infusion and what the paramedics thought. There are a few post-infusion instructions. Since we will be processing things that haven't been processed in a while, you may be a little emotional or sensitive after your infusion. We highly recommend that you get your favorite food, go home, and rest for the night. After your infusion, it is not recommended to drive for the rest of the day. We do ask that you either Uber or have someone pick you up after your infusion. We will have a staff member walk you out to your car to make sure you get in safely. Since your brain and your emotions can be affected during the infusion, we recommend after your infusion that you stay away from stimulus. That being, don't watch the news, don't go Amazon shopping, and try to keep your night as light and relaxing as possible.